So here we go. So hi, everybody who is online with us right now. I can see we have a couple of people here. I'm sure that will grow. My name is Kate Milliken. I want to welcome you to MyCounterpane's Empowered by Webcast. This is a show that works to connect people living with MS to experts who are doing groundbreaking research. We also want to give you an opportunity to hear the words from those experts, as well as balance it with a true life experience from someone living with MS. And today we have an incredible show with three incredible guests on the subject of MS and stem cell treatment. So if you are online right now and you are Googling MS and stem cells, you're getting a lot of different types of videos, and we'd like to show you one. Okay, guys, so I want to introduce our guests, and we're going to respond to that video and dive right into it. So with us in the upper right corner of the Brady Bunch array is Dr. Timothy Coetzee, who leads advocacy services and research for the MS Society, the National MS Society. Tim is a scientist by training, and he has his hands in numerous programs that the MS Society runs to fund cutting-edge research. He also leads the teams that advocate to legislators and provides vital services to people living with MS. On the webcast, also in the lower left-hand corner, we have Nadine Shapiro and Cordelia Vahaji. Nadine has been living with MS since 2001. She got an SSCT transplant in 2013. Cordelia was with her every step of the way, and we'll talk about that experience in a moment. But first, Tim, I'd love to start with you, and I'd love for you to set the scene about kind of Stem Cell 101.
Sure. Great to be with you, Kate, and Nadine and Cordelia, and everybody on the show with us. So Stem Cell 101, pretty at a high level, we all have billions of cells in our bodies, and what stem cells are special kinds of cells that are able to make more copies of themselves. And so the way to think about it is, if you think about our skin cells basically have one job, and that's to cover our body, and they're really cells that will never become anything other than a skin cell. A stem cell is different in that it's a cell that can make other types of cells. It can make a skin cell, it can make a fat cell, it can make a nerve cell, and so the job of a stem cell is to make more copies of itself and to really create cells that can go on to do special things like skin or blood cells or a nerve cell. Reason why people are excited about stem cells and why scientists really are trying to chase those for potential treatments is this possibility that you could take a cell and really make more bone marrow, as we see in the HSCT that we'll talk about, or create a cell that can repair the nervous system like we have in MS, or even other stem cell treatments for heart disease, for example. And there's a lot of interest in build new heart cells. And so that's the excitement around stem cells, and really lots of possibility around what they could be for the future treatments, like you saw in that video that we'll talk about.
So in the realm of stem cells and actually making treatments, are there actual different types of stem cell treatments, Tim?
Mm-hmm. Sure. So there are different kinds of stem cell treatments, and I think the most common one that you'll hear people talk about, and we'll hear from Nadine and Cordelia's story today, is what we call HSCT, or hematopoietic stem cell transplants. And basically, what HSCT is, hematopoietic is a long word that we scientists basically give to the cells that make blood and bone marrow, and the white blood cells and red blood cells. And essentially, our bone marrow is filled with these stem cells whose job it is to make either blood cells and the white cells that are part of our immune system. That's the most common type of stem cell treatment you'll see. There are others that are in development, so you'll have adult types of stem cells where basically, you know, researchers are taking cells out of, say, fat tissue, and fat cells, adipose cells, and you know, fat cells actually have stem cells in them, and they try to, you know, you can reprogram those to do other things like potentially repair the nervous system, tackle the bloods, you know, tackle stuff's going on in the bloodstream. So that's another type. You'll also hear a lot of conversation around what we call embryonic stem cells, or what we call iPSC stem cells. And you probably remember a few years ago, there was a lot of controversy about embryonic stem cells because those were ones that had the potential to make any cell in the body, and you know, they were pretty controversial. iPSC's stem cells are a new technology that was pioneered that can basically take a cell like a skin cell and through some genetic manipulation really reprogram that skin cell to become like an embryonic cell that can then make anything. And that's really exciting, and allowed us to think about, you know, new strategies for stem cell therapies. You know, when we think about the clinic, what's in the clinic, what's closest to being in terms of treatments for people with MS and other diseases, it's HSCT. Right now, that's the one. There are others that are trying to get to patients, and we can talk about those a little later.
Cool. And which is such a great segue to Nadine, because Nadine, you made a choice to have a stem cell treatment in 2013. It was HSCT. Super curious to both of you of what led you to decide to do this.
Well, I was in a nursing home and I got out. Cordelia found Dr. Burt's study, Dr. Burt in Chicago, right? I don't remember a lot. I was really, really sick.
I think it's fair to say you didn't really make the decision. She was she was having a lot of, you can speak to your symptoms, but she was having a lot of pain in her legs, a lot of spasticity. She was pretty much frozen and could hardly walk. It took 3 people to transfer her, which is why she was in a nursing facility. Yeah. So it's pretty depressing to be, I mean, at the time she was 34. So she was basically, she had, you know, a roommate who was a stroke patient, a lot of dementia patients. And so I think, like, for her, she was just so living this traumatic event and declining so rapidly. She has a very, I mean, she's not progressive, but when she relapses, it's very, very aggressive. So I basically did the research. I live with her. I've been in a caregiving role. So I did a lot of research, and I basically found 2 trials. One was just pure stem cells, and the defining factor with HSCT is they administer chemotherapy. They use Cytoxin, and that was actually a drug that Nadine responded to very well, so I was excited. She had progressed too far to qualify for the treatment, so she was treated on compassionate care. So I basically brought her all the facts and was like, you can speak to this. Like, you're pretty much guaranteed to get dramatically worse and live permanently in a nursing facility.
Or try this,
or we have a chance at something improving.
Wow. So not only, I'm sorry, go ahead, Nadine.
I was just going to say, I've been on chemo before for MS, back in 2001. Nothing was really working, and I was on Cytoxin for 9 months. I had pulse therapy, and it worked terrifically. I mean, it wasn't as much chemo as is used when I had HSCT, but that was incredibly helpful for me. And I always ended up being on a combination. I mean, I was on beta-seron for years, but in addition, I was also on very high doses of Cellcept. So,
yeah, so
immunosuppressants really work for me.
Wow. Well, not only did Cordelia do a great job of doing some research, but she also had the wherewithal and smarts to roll some video about your story. We have a 2-minute excerpt from the video that you have about your story, and we'd like to show it now so people can see what happened as a result of this choice.
Dr. Burt has refined a procedure known as HSCT for the treatment of relapsing, remitting MS and other autoimmune disorders. The process is similar to that used in blood cancer treatment. Patients undergoing HSCT for MS receive a high dose of chemotherapy to wipe out most of their immune system and then they received their own bone marrow-derived stem cells back. Within weeks, we had made numerous trips back and forth from Massachusetts to Chicago as Nadine went through pre-testing. She received Neupogen injections to promote stem cell production. She had a Bass cath inserted into her neck so that she could have the stem cells isolated from her blood. During that process of pheresis, she was hooked up to a machine for a full day in order to isolate enough stem cells for a later transplant. At the beginning of May, she was admitted to Northwestern for the core treatment. She underwent almost a week of receiving IV fluids followed by 4 days of chemotherapy. On May 13, 2013, with Dr. Burt, her nurses, and the hospital chaplain there to bless her stem cells, she received a 30-minute transplant or infusion of her own stem cells. We then waited about 10 days for her stem cells to grow, for her counts to increase, and for her system to stabilize enough that she could be released. At the end of May, we left Northwestern and Nadine went straight to inpatient rehab, where she received about 4 hours of intensive one-on-one physical therapy every day. Her recovery was astonishing, as with each day she regained function, strength, and balance. After a year, she showed no signs of ever needing a wheelchair or assistive device. And on our 2-year follow-up on May 13, 2015, we were informed that her most recent MRI showed no new activity and in fact a decrease in lesion size.
Wow. So it's so much fun and so powerful to see such an amazing story of recovery. So when you look at this video, it almost looks like, wow, you go to the hospital, you get this treatment, you have 2 weeks of chemo, and all of a sudden it's all great. What we're not seeing that you guys had to go through as a result of HSCT therapy?
Well, I'll say that everybody's different. So, I mean, I think I'm more of an extreme example. I left in the same position as I went in. I mean, I left in a wheelchair. I went directly into inpatient physical therapy, and that was for over a month. And I mean, I went from wheelchair to walker to quad cane to single point cane. So I didn't just have my stem cells reinfused and blocked out. I mean, but some people do. Some people don't need the kind of assistance or therapy that I needed. I think that was critical for me. When Dr. Burt first met me, my EDSS was a 6.5, and now it's 3.5.
And let's stop you right there. Tim, can you tell everybody what an EDSS stands for?
Sure. So EDSS stands for Extended Disability Status Scale, and basically it's a tool that doctors like Dr. Burke and neurologists use to measure, how MS is affecting a person. And so there's, it's a scale of 1 to 10, 0 to 10, with 0 of course being nothing, and then different levels in between based on, whether a person is walking with or without assistance. Are they in a scooter with or without assistance? Are they, confined to, or are they immobile? And so it's the number basically that gets used to measure the impact of MS clinically. As doctors
a 6.5 is legitimately disabled.
That's pretty severe. It's on the higher end of things, and because once you start getting to 6, 7, and 8, that's the most advanced and really, what Cordelia's experience, Nadine's experience, is really what gives people hope about HSCT, that you can change and really move the needle, which is what we're hoping for with all the MS treatment.
And it's very real. These results are not just a one-off. This has been happening. In actual many case studies. Is that correct, Tim?
Yeah, so we've seen that happen. Nadine's story is, I've met other folks who've had it as well, similar, where what we're learning about HSCT is that, particularly with cases like Nadine's, where it's a young person who has very aggressive MS that isn't responding to any of the treatments, typically are the ones that respond most effectively to the type of treatment that Dr. Burt and others are doing. because in essence, what they're trying to do with this type of treatment is reset the immune system to not be as aggressive. And what we don't know right now is how many people living with MS have this particular aggressive type of MS versus others who may have a type of MS that's not as aggressive. And so for them, one of the existing treatments is about all they need. And so we're trying to, part of the work that we're doing with, other doctors working in this area is to figure out what's the right patient. I mean, clearly in Nadine's case, you were the right patient for this treatment at this time. And, because not everybody necessarily needs as aggressive a treatment.
Go ahead, Cordelia.
I just wanted to add something really quick about that. So right now, Dr. Burt's, this is a FDA phase 3 clinical trial. It's in the late stages right now. It's going to wrap up in a couple of years. So it's looking very promising. This particular trial is centered around relapsing remitting MS. So we didn't actually know what Nadine was. People thought she was treated at Johns Hopkins at the same time. And so they were not sure if she was really still relapsing remitting or not. Dr. Burt treated her off study, as I mentioned before, because her EDSS score was too high. I think she needed to have something like a 6 at maximum, and her EDSS was too high, but he thought that she was still in a very active state because of looking at her MRI and seeing the expansion of so many lesions. And then I just want to say very quickly, in terms of just witnessing, taking her to the hospital, being, along for the journey through so many of her hospitalizations, when I initially was trying to, present her with information about HSCT, I was very concerned about the risk of death, the risk of infection, all these various things. And right now, last I checked, nobody had died from HSCT for MS through Dr. Burt's trial. The risk is a theoretical right now, like there is a percentage risk of death, but nobody's actually died. And in fact, when we were there, it's a very state-of-the-art hospital. Nadine was in a private room. People came in gowns and gloves, and it was she went through a lot of pre-testing. Her drugs were tweaked. She had extensive testing through cardiology. I couldn't believe how extensive it was. Dr. Burt was checking all of her vitals, tracking her very closely. And really, I think she had greater risk factors and a more miserable experience through some of her other more traditional hospitalizations and therapies than she did with HSCT. She never had so much as an infection, to be completely honest. I know some people do. We're part of a patient forum, and some people report some symptoms, side effects, getting a flu, but there's never, we haven't heard anything very scary happen to people. So I just encourage people who are interested to explore for themselves. I just talked to a lot of people, and I'm a scientist by training, so I just went to the research and I just started looking at the journal articles. And even if you can't understand the journal articles, there's a lot of really good, like Science Daily breaks down some of this stuff.
And for me, it ended up being an issue of quality of life, really. I mean, I was in so much pain and remember very little of it. So it wasn't hard for me to decide because there was nothing else to be done.
I think you bring up a really, interesting point, Cordelia, and it's great. Certainly, Dr. Burt is somebody who works out of Northwestern that has become quite renowned in this field. And I think it's, Tim, you can certainly comment on what Cordelia said, but, one of the things that has been clear, especially in the media or whatever else, the whole idea of where people choose to get this done. Obviously, you guys had an incredible experience. Turns out that Northwestern is renowned for this type of work, but I would like to show you an article, a headline of an article that came out in the New York Times last week, actually. And Tim, I would love for you to talk about the article, which profiles a man who had a stroke who made a different choice on where he got his stem cell treatments. Why don't you tell us, Tim, and hopefully Corin will be able to give the headline.
Sure. Yeah, so the story in this case was, the result of someone who had another kind of a stem cell treatment where he'd gone out of the country and basically had tried several other treatments in different countries using not HSCT, not the bone marrow type of stem cell treatments that we have a lot of medical experience, but these other kinds of adult stem cells, which in his case were sometimes fat cells, sometimes bone marrow cells, sometimes embryonic cells or fetal cells. And what happened in his case is that they actually put those stem cells directly into his spinal cord, so right into the brain, and they call that intrathecal, which basically is they put it into his spinal cord to try to bring him relief from his stroke experience. And unfortunately, in his case, what happened is those cells actually ended up creating a large tumor in his spinal cord, and so now he's actually in a worse case. And they were able to, the doctors went in, they sampled it, and they were able to show that these aren't his cells; they are the stem cells that were put in. And this raises a really super important question that for people living with MS and any other actually disease where you're thinking about a stem cell therapy is, do you have confidence that the cells that are being put into you are going to do what you say they are? In the case of Dr. Burt and the other doctors working in HSCT, there's very high confidence because it's not just experience with MS, but keep in mind this technology was developed originally for bone marrow transplants to treat leukemia. So we've got, decades of experience in this kind of treatment. And so you can have, confidence that, yeah, okay, this is going into me. I know it's going to do what it says. The scary part about some of these other stem cell treatments is you don't know what's going to happen with that stem cell. And in this gentleman's case, unfortunately, it turned out pretty poorly for him. And I think the advice we give and the perspective we have is that there are. I don't want to leave the impression that this type of stem cell therapy for nerve repair and other types of things shouldn't be pursued. There's a doctor in New York City, Dr. Saud Sadiq, who's actually doing a stem cell trial with mesenchymal cells that he's trying to basically put into the spinal cord of individuals to promote nerve and myelin repair. But he's doing it under really strict FDA guidelines and really paying attention to all of the considerations, because you want to have confidence when something goes into you that it's going to do what it says. Yeah. And the thing about stem cells is that because of their ability to make lots of copies of themselves and do other things, they can do the unexpected. And so it's really important that we balance and people, individuals really think about this and consider, is the doctor experienced? Do they have the data that says, yes, these are going to do what we expect them to do? How are they monitoring you? And, do we have confidence in what the stem cell will do? And, I think this kind of research is really important. I really want to emphasize we need clinical trials of therapies besides HSCT, so that we can get, nerve repair, myelin repair, which is really the big focus in MS right now. But it also needs to be done in a way that you can have confidence that, if I'm participating in this, this doctor A knows what he's putting into me, and B, I'm going to be monitored so that I can, have, good outcomes.
Let me just make 2 points, which I feel are crucial for this webcast. We can talk about certainly.
I lost you, Kate. Well, I will host for Kate. Hey, Corin, do you know if Kate's going to be coming back? It looks like we've had some technology issues.
Maybe I can add something at this point.
Sure.
I just wanted to add that, as you mentioned, Nadine was actually treated on the blood cancer floor at Northwestern. Yes. So she was surrounded by people who were receiving this treatment for lymphoma or leukemia. And so, as you mentioned, there's already decades of experience treating those patients. In her case, and with HSCT for MS, it's autologous, so it's your own bone marrow derived stem cells. I know that with some other, other individuals that get HSCT for other disease states, that's not always from your own body, so there can be problems. But we did the research, and it looked very promising with very low risk. So I want to emphasize that, because I had a lot of fear myself going in, and it is a serious procedure, and it takes consideration. But I just couldn't believe how well Nadine performed, considering where we were at previous treatment in Massachusetts. She was not doing well. She was in a lot of pain, and she wasn't being treated that effectively. And then HSCT was like,
Amazing.
So much simpler after that. It was really amazing.
So Tim, if I'm sorry to interrupt, if you were going to say to somebody who obviously is hearing such a great experience from these two, obviously Dr. Burt at Northwestern is a great place, but what would be the specific advice you'd give to someone who would say, I really do want to do my research. I really do want to figure out the right place to go. Where do they find it and how do they go about it?
Right, so obviously Dr. Burt's got a lot of content on his site at Northwestern.
And we'll leave a link to his stuff in the takeaway.
Certainly, and we have on the National MS Society, we've got a ton of information on stem cell treatments and what, what are some things you should think about. I would also, have a conversation both with your doctor and your partners and caregivers to say, and ask the question. I would ask the question that, is my MS at the place where, undergoing the, as Nadine and Cordelia say, it's a rigorous treatment. It's not, it has a lot of factors that you need to weigh. And I would ask the question, am I in this place where this is the right treatment for me right now?
And wait, Tim, let's make it super clear, because I think there is a misconception in the outside world. Obviously, Nadine, you were incredibly progressed, which one might think you were progressive. However, that is not the case. And my understanding, Tim, correct me if I'm wrong, is that actually stem cell treatment, HSCT, is not good for people with progressive MS.
Yeah, the data tells us right now that people who have progressive MS, that unlike Nadine's case, where you can see a lot of new lesions popping up and seeing things on MRI, if they're not seeing a lot of new lesions and really super aggressive relapses, those individuals don't respond well to this type of treatment and end up not being selected. I know in Dr. Burt's study, if people are in a progressive MS, they're not accepted into the trial. And so that's one of the big things I emphasize, is if you're living with what we would call secondary progressive MS without a lot of new lesions or relapses, or even primary progressive MS, it's not likely that this treatment's going to work. And that's because, basically what the science is telling us is there's probably something else going on in the MS in these individuals. It's perhaps loss of nerve cells, and it's really not the immune system probably that's as involved. And really what HSCT is it's a complete reset of a person's immune system to basically take their body from rejecting the brain to basically seeing the brain as just a normal part of everyday living. And that's really the big shift. And what some people are thinking about is, with the advent of a treatment like Lemtrada, which is a very strong reset also of the immune system. Some people are considering that versus HSCT. Both have their strengths and weaknesses, and so individuals have to, I think, have a good conversation about what they, and I don't live with MS, so I'll certainly leave it to Nadine and Cordelia to speak to it, is each individual needs to weigh the benefits and risks and what they are individually comfortable with, because this is a hard choice. Although I think in Nadine and Cordelia's case, you made the choice pretty quickly.
Absolutely. Is there anyone who is on this webcast right now that would like to call in? Please let me know. We'll see if anyone pops up and see what the story is here. Tim, just really quickly, I feel like the last time we had the whole MS world kind of aflutter about something new was CCSVI, which was a number of years ago. Can you give a very brief overview of what that was and how this is a little bit different?
Sure. So CCSVI stands for chronic cerebrospinal venous insufficiency. Basically, the idea was that, and it was an observation made by Dr. Paolo Zamboni in Italy, that, and others after that, that there were these, that the veins coming from the brain that were draining blood from the brain were constricted, and that, this kind of slow flow of the brain, slow blood flow from the brain was contributing to the particularly progression in MS. We funded some studies to look into this to see whether or not these vein malformations, as they call them, contributed to the progression of the disease. The science is telling us that while there do seem to be these abnormalities, they don't seem to contribute to the disease progression or those aspects of the disease. Individuals who've had the vein treatment, report improved symptoms and sort of less fatigue. you know, what we are learning now afterward from some additional science that others are involved with is that blood flow matters. And so, you know, blood flow to and from the brain, you know, really is important. And we're actually funding some research to understand what's going on with blood flow to the brain. We've discovered as a result of some work, there's a whole new type of, you know, system of draining blood from the vein that we didn't even know existed until some work. So, you know, I think, you know, the bottom line on CCSVI is that it probably isn't contributing to the progression of the disease, but probably has some factors and some contributors to the symptoms.
For this one, this is becoming a lot more clear. Specifically for MS, is actually helping a small percentage of active, relapsing, remitting people with MS.
Yeah, exactly. Thank you for, you know, reminding me of that. I think that, you know, what HSCT represents is you know, a new strategy and a way to move forward as a treatment for a subset of people living with MS. You know, I was just with a doctor yesterday, Dr. Mike Racky, who's also worked with Dr. Bird and others, and you know what the doctors who particularly work in this space now are trying to do is figure out how we can take an even larger trial than the one Dr. Bird is doing, and really try to see, you know, how would we do this in multiple locations? How would you make this more available so it's perhaps less more cost effective, and you know, really make this more available, you know, to people around the country. That requires some organization and some resources, and we're working with the doctors to figure out how we do that, and how we can also get our federal government, the National Institutes of Health, to fund this, because it would be a large study. But you know, the bottom line for me is, as somebody who cares a lot about MS and MS research, is that we need to answer the question of who, you know, how do we get this available for more people so we can have Nadine's story be repeated.
Right. I would love to, we started this broadcast, for those of you that just joined in, we started this broadcast or this webcast with a video that's going around online that really simplifies the whole idea of HSCT. I'd like to play it again, and then I would like Nadine, Cordelia, and Tim to add the elements that we've learned from this webcast that are not part of that video, and then we'll go from there. So Corn's going to play this video one more time. Nadine and Cordelia, anything you would add to that video that you feel the people watching need to know?
Where's the chemo? Why didn't they mention the chemo? I think people get taken advantage of. Probably. I don't know.
Well, I think what she's getting at is, I think that just, you know, talking about this so much in the patient community and doing research myself, there's a lot of, you know, I think we keep talking about stem cells, and it's definitely stem cells, but Dr. Bird is an immunologist, and what he's really focusing on is wiping out most of the immune system and then resetting it through the use of stem cells, because stem cells, you basically have a year after treatment when you get your stem cells that your body is, you know, you're very vulnerable because you're regrowing that secondary or new immune system. So I think throughout this discussion, when we talk of stem cells, there's a lot of therapies outside the country where, you know, kind of like what I'm not familiar with that particular stroke patient who had an injection, but I know there's a lot of places that are feeding. When Nadine says taken advantage, I think there's a lot of people and clinics that are kind of feeding on people's hope, especially since they hear about stem cells.
The hope is real, right? For some people, the hope is very real, and that's the conflict.
This is like data. This HSCT is different, and it includes stem cells, but it's not just a stem cell therapy. So I wanted to make that point. I also wanted to add that we happened to have, Nadine had a very positive experience. Her doctor was at Johns Hopkins, and when Dr. Burt wanted to treat her, the two doctors, the neurologist and Dr. Burt, who's an immunologist, spoke and got on the same page. That seems very uncommon from our experience talking within the patient community. A lot of people go to a neurologist down the street at their local hospital or clinic who doesn't have his or her finger on the pulse of the research community, doesn't know about this, starts thinking about like all these scary stem cell procedures that are popping up, and might not necessarily be that supportive of the procedure. So I think if you're a patient and you're interested in this, I definitely encourage you to get involved with the patient community and just get some information for yourself. And, you know, I just think it's worth exploring. And I don't think if your local doctor isn't supportive, it's, you know, you necessarily need to stop there. You might just need to find a doctor who's willing to explore this with you. I'm not saying it's the right option for you, but I definitely would get a clinician who's really familiar with the science and can speak with you about that.
Well, no matter who the doctor is or what the experience is, I think the overall takeaway from what you just said is working really hard to educate yourself through a myriad of forces. And in fairness, there are a lot of scary things that come with HSCT. There are a level of clinicians. Some are who more educated than others on what's cutting edge and what's not. Every case is individual for sure. But certainly, Tim, you would say for out there, whether it be the National MS Society, other places, there are resources that could guide you to making the right decision for you.
Oh, absolutely. And I think, you know, Cordelia spoke about it beautifully, that, you know, each person needs to find the information, find a physician that works with you. This is a challenge. I mean, this is, for some doctors, they look at this procedure and they go like, wait, why? You know, this seems incredibly aggressive. And, you know, the physicians are, you know, they're trying to do the best they can, but this also, for some of them, is a step too far. And so finding a doc that's ready to work with you is really super important. There's stuff, you know, content on our site. There's, you know, if people are thinking about other types of stem cell therapies, I would definitely encourage them to visit the International Society for Stem Cell Research. It's a society of, they're the stem cell scientists that work together, and they've created some beautiful resources for people to just. It's more about giving folks information to help them make a decision. They don't try to be overly prescriptive, but they, you know, these are the folks that know this work, and, you know, just give information. So if someone's going out of the country, you know, you can think about, you know, you can consider it. You know, the other thing I'd say is there's lots of groups on online. You know, Facebook has lots of HSCT sites where people can go and see the conversation. And I think it's really, you know, the experience of Nadine and Cordelia, and I see Ellie Baum just joined us from Chicago, who I was on the phone with earlier this week. You know, there's a lot of passionate proponents of this, and I think part of what I want folks to, you know, leave with is, understanding that this is a treatment that is right for some, most likely, but finding a doctor that's going to partner with you. And also, you know, what I don't like about that video, to be frank, is it oversimplifies things.
Yep.
As Nadine and Cordelia pointed out, it makes it seem like, hey, you know, I'm just going to
waltz into Canada and here I go.
Yeah, exactly. And that's just not. It's not like that. Actually, it's a, you know, you have to be prepared for this. It's a serious treatment, has serious potential. You know, there's lots going into it. And so it oversimplifies things, and I think it sometimes can play on hope a little bit too far as you know, for me.
Chicago, Ellie, can you call into this webcast and tell us a little about your experience, or is that not a possibility? Let's see if we can get you in here. In the interim, while we wait for her, Nadine, how are you doing today?
I think I'm doing very well.
Essentially no mobility issues, no assistive devices.
I'm not on any MS drugs. It didn't solve everything, which I didn't necessarily expect.
Yeah.
But physically, it was tremendous. And it's also easier to see what's wrong when there's something wrong. It's easier to measure it.
When it's physical, yeah. It's easier to calibrate and measure the physical improvements.
I have a lot of cognitive issues, and it didn't help that at all. But physically, it was unbelievable. Cool. It really was.
I just want to add that the point of the procedure is not to reverse you back to who you were. It's really just to put you into a permanent state of remission. And if you see improvement, great. I mean, Nadine had a best case scenario, but we also put her into intensive rehab, and she kicked butt every day for hours a day, doing a tremendous amount of hard physical work to get back to where she was.
Right.
So
cool. Hi, Ellie. It's so nice to see you. Thank you for calling in. I'm super curious. Can you give us a little brief about your experience?
Sure. I had HSCT this month. Prior to mobilization, I was using a walker. I am now not using any assistive device at all. I've also had much less spasticity. It's decreasing every day. Incontinence over. Trying to think what else, but it's really.
What do you mean? What else? That's like amazing.
It is amazing. Yeah. So I had a steady decline since last June. So it's I'm pretty passionate about it. As Tim said, I had a call with them, and I've been following Nadine closely, and nice to see you guys real time.
So, Ellie, can you talk to me about the hard work and the kind of enormity of the procedure itself in terms of being sick, not feeling well, and trying to get on with your normal life?
You know, I think compared to living with MS, it's nothing.
Yeah, really.
You mean the procedure, HSCT?
Yeah.
Yeah.
I agree.
Well, it's something amazing to know that you've done something and something's different, and you're working now with a different set of goals that are attainable too, mentally, right, and spiritually. Mm-hmm. That's a whole new deal too. How did you figure out where you were going to go for your treatment?
Well, you know, I actually learned about this study back in after I was first diagnosed. I think it was 2003. When they were first, I think around the time they were first recruiting for people. I have a friend who works in media, and she interviewed Dr. Bird, or her firm did. So she came to me about it, but I wasn't ready at the time. My son was young. I was newly diagnosed. So then after I had this major relapse, 12 years later.
And very aggressive one, correct?
What's that?
Was it a very aggressive relapse?
Yeah, my first ever relapse, but it was aggressive, and I had to stop working. So it really threw me. So it was time to find out if Dr. Bird's study was still open, and sure enough it was, and the rest is history, or will be.
That's really great. Well, we really look forward to, I hope we can keep up with you and see how you're doing and in real time, over time. It's hugely exciting to really get to see two incredible cases of this, but I also really appreciate having an understanding of everything that's involved with it. Before we sign off, Tim, I want to know if there's anything else you want to add, and I'll give the same floor to the both of you. Tim.
No, I think Ellie and Nadine and Cordelia's story is inspiring, and I think, as Ellie knows, I mean, we're really focused on how we can move this forward and get the doctors working together. As I said, part of our big challenge is getting the medical community to get organized around this and getting all of the neurologists to sort of see this as a strategy. And also, I think helping folks understand what's the right stem cell treatment for you, and when, and where you are in your journey. I think, videos like that, the one you showed, are, they're interesting, but they also, I think we need to help people sort of figure out what's right for me. And I think shows like this are really important in sort of sharing the story of A, what can happen and what we may be able to do in MS, and B, what are some of our challenges ahead of us. And I just, again, appreciate all of you, the conversation, so that we can really make it, change people's lives.
Before we get into the kick-ass patients on the right side of the screen, one more follow-up. What do you feel is the hesitation of the physicians that you're trying to get organized around this?
Sure. It comes down to the fact that, we have, all these other treatments that don't require as aggressive, a prep for that, like HSCT. And I think the docs have all developed, we have, like 20 years of experience of using things like Avonex, Betaseron, Rebif, and others. And so that, experience for many of them, they think about it as doctors, and they say, so is it a weekly injection or a monthly infusion versus HSCT? And I think naturally the medical community is conservative. I mean, you all see your doctors. We've all lived
conservative neurologists, I think.
Yeah, and so I think that's part of it. And I'm not trying to throw them under the bus. I think they're trying to be careful doctors and, paying attention to the patient in front of them. And so I think helping get the information that says, okay, for these patients, this is the right treatment for these patients at the right time. And, making sure, for me, the other thing is making sure that we can have the conversation about, if this is a treatment that's right for people with relapsing MS, what's the conversation we have with individuals who have progressive MS or other forms of MS for whom this isn't an option and feel super frustrated that, the story that Nadine and Ellie can share isn't the story they can have. And I think that's part of the conversation that, it's part of the work that I'm trying to do with the Progressive MS Alliance and other things, because I want everybody to have these stories, not just a few people.
Yep. Nadine and Cordelia, any last thoughts?
I just wanted to add, we keep talking about the risk factors involved and how kind of scary this is, and it certainly is, but honestly, before Nadine made the choice to do this, she was looking at Tisabri, and she tested JCV positive, and she was at pretty high risk. I mean, it's still low risk, but she was very concerned given her atypical situation, would she actually start getting a lot worse and then, potentially be looking at, possible death from, an extreme case of taking Tisabri. So I just want to say that there's risk factors with the drugs. We're just more used to them. And also, if we hadn't intervened at this point, she probably would have progressed to a point that it just would have been a downhill spiral and chronic pain. So, I think it is definitely risky, but the drugs are risky too. And yes, she's had some really bad side effects from being on drugs that she doesn't have to deal with now. So I think just balancing it, like, don't just buy into the hype of like, wow, this could like all go wrong, I could die. Just get the information and look at it for yourself. As I said, I just went to the data. I wanted the science. I appreciate also the anecdotal stories and talking to patient community, but I really, like, the first place I went was, show me the data, I want to see. And I asked the doctors and the entire medical team for information on, what the side effects were, how many people had died, and really wasn't as dismal as I thought it was going to be. And her experience was very positive compared to where we had come from in our hospital before this. So they're a very attentive staff. I can't speak to HSCT being done anywhere else, but Chicago was amazing.
Yes.
And I do want to clarify one thing. I think, and Tim, you may not know, I don't want to put you on the spot, there have been deaths in trials. Is that correct?
There was one in the death,
okay,
one in the Canadian study, but the big difference between the Canadian study and Dr. Burt's study is that the Canadian study is really more like a classic bone marrow transplant, where it's a full-on replace everything, and you wipe out a person's bone marrow, whereas in the Dr. Burt's approach, it's a partial, so you don't have those risks associated with it, and that's what the scientists who are starting to think about this are starting to weigh how you approach this. And Dr. Friedman would be the first one to tell you, that's one of the challenges they're facing with the Canadian study.
Yep. And Ellie, because you are so wonderfully courageous to come onto our show, is there anything you'd like to add before we sign off? Besides the fact that you're blissful.
Oh, I am blissful. That's all I have to say at this point. I want to keep where I am in 5 more months.
Well, listen, that is a great way to sign off on the show. I want to thank Dr. Coetzee, Nadine, Cordelia, Ellie, everybody who joined us on this. I hope it was beneficial, and we look forward to broadcasting this in the future and making sure everyone has a full understanding of their options, because we are all about giving people options of what they can do now with their MS. I'm Kate Milliken signing off. Thanks, everybody.
Thanks,
See you
everyone.
next time.
Have a good day.
Thank you.